Hello everyone. There's a question asked by patients who are going to undergo a surgery. Doctor, when will you operate on me? Well, we often have 2 or 3 patients a day. I don't like to have too many cases. I don't take more than 3 cases a day. But the patients ask, who will you take first, doctor? Take me first. I have a flight, doctor. Let me catch my flight, and so on. So I wanted to explain in a short video how many patients are taking in what order. Now, there are some criteria when you think about which patient to be taken first. If the patient is a child, the child is taken first. This is one unchanging rule. Secondly, if the patient has diabetes, he is also taken early, because the patient must be hungry for some time. It is given, but the hunger should not last too long, so that the blood sugar does not drop. If the patient is diabetic, we have to operate as early as possible and discharge him as early as possible, so that he can start early with the diet, insulin, and medication. In addition to these two, there are many other factors. It may be that the patient has a flight, he has to catch the plane early. We have to do the surgery as quickly as possible, get him to his room early, and I wait him to wake up. We can discharge him depending on the flight time. By then, he has to be awake, and so on. This is one of the factors. Other than that, the patient may have hepatitis. Normally, after the patient with hepatitis, we don't take another one. So we have to take the patient with hepatitis at last. Patients who have no sign of infection and whose infection tests are clear are taken first. And the patients with hepatitis are taken in the end. After the patient is discharged, the whole operating room is disinfected and the instruments are especially sterilized. Now, in some diseases, this disinfection is difficult. For example, hepatitis. Hepatitis is a difficult thing to disinfect. Therefore, discharging a patient with hepatitis, the entire operating room should be disinfected and instruments should be entirely clean. This is not the case, for instance, for AIDS. If you have operated on a patient with AIDS, standard cleaning is usually sufficient. It is sufficient if the instruments enter and leave with the standards, because HIV is a very weak virus. Within half an hour, if it doesn't stay disinfected site, it dies anyways. But this is not so with hepatitis. In cases of hepatitis, the operating room should be sterilized in the evening. Sterilization should be done with special ultraviolet lights. That being said, some cases are long and some are short. Depending on the mood that day, my thought is this: let's take the short cases first and leave the long cases for the last. Otherwise, anesthetists may have an idea. Anesthetists say the patient's work is more difficult, intubation and so on. He might say, let's take that one first. Otherwise, the patient has thoughts and wishes. I have a flight, etc. There's also something like this. Kits may be important in this context. Sometimes we may say, like, take this kit. When we get the second case, we'll take the second kit. The kit we use in the first case is sterile at this time. In the third case, the kit we used in the first case is sterile. We use it in a third case. You may say, let's do that kind of planning. That's not quite true with us. As I always say, we get at most 3 patients a day, and we have 3 separate kits for those 3 patients. We don't have a problem here. But on occasions when the number of kits are limited, or for instance when a very special instrument is used for that operation, and when there are 2 cases in which that instrument is used, one is taken out and the other third, so that the special instrument may be sterilized during the operation in between them. Then it is to be given for the sterilization, and so on. There are lots of such factors. What do you have to do? Tell your doctor your wish, of course. Say, I have a flight, I don't know. Say, I want to go home earlier, I want to leave early in the evening, and so on. Tell your doctor this. But they will create a program by considering other criteria as well. Your doctor will meet with the anesthesiologist and they will meet with the nurse. We'll get the patient in early. Is the equipment available? He'll ask the anesthesiologist. The patient wants to be taken early. Can we take him? Programming like that is done. But generally, those criteria are taken into account. And as I said, children and diabetics are generally taken first. There is nothing more to discuss about it. Yes, that's all I have to say on this subject. Thank you for listening. If you have any questions, post in the comments or, as I always say, send me a message. I'll get back to you as soon as I can. Goodbye.